I'm Todd Neale with MedPage Today for InFocus at the American Stroke Association's International Stroke Conference in Los Angeles. I'm joined by Dr. Louis Morgenstern, Director of the Stroke Program at the University of Michigan and Program Chair of this year's meeting. Thanks for sitting down with me.
My pleasure.
Now we're coming to the close of the first day of the meeting. I was wondering if you could discuss what you think some of the highlights are of the first day.
I think that there's been a lot of highlights, and it's hard to choose one particular session that I enjoyed, particularly this morning, was a session on how aggressive we should be in caring for patients who have intracerebral hemorrhage, one of the most feared types of all stroke.
And can you talk a little bit about what was involved in the session, what kind of topics were covered?
So traditionally, many doctors believe that intracerebral hemorrhage is a universally fatal condition and that we shouldn't be very aggressive in caring for it. And this session was a debate. And so Darren Zaranek from the University of Michigan was asked to take the perspective of someone who believed that we should let people die with dignity, that we shouldn't intervene when there are very few odds of actually helping people get better, and that we should allow people the time to prepare for death, and that there really was no evidence that we could help people with intracerebral hemorrhage. Claude Hemphill from the University of California, San Francisco was asked to take the opposite opinion in this debate, that our uncertainty in what happens with intracerebral hemorrhage makes physicians give up too early, and that leads to self-fulfilling prophecies and having perhaps thousands of people die unnecessarily in this country from intracerebral hemorrhage. And then finally, Reverend Philip Jackson took a spiritual approach in trying to figure out how we approach having a very severe illness, saying that sometimes death is not the worst alternative and something to consider. Also respecting the values and beliefs that patients and families have and the role that families have in making decisions. And importantly, involving spiritual and religious ideas and clergy in situations where it is end of life and important decisions need to be made. And I think all three parties provided some unique perspectives, and there was a very spirited discussion at the end of the session.
Now you also attended a session on some of the behavioral changes that people can make to prevent stroke, lessen the risk of stroke. Can you talk a little bit about that?
Right. So I should say that I created a session perhaps 5 years ago about behavioral change for stroke, and I think that there were about 10 people in the room. This afternoon, the session overflowed into the hallway. There were hundreds of people in the room, and I think it shows that we now have many different things that we can do to prevent and treat stroke, but still relatively few people get those therapies. There are still plenty of people who don't have proper diet, who are overweight, who continue to smoke, who don't treat their blood pressure accurately or aggressively. And we know with acute stroke therapy, only a few percentage of people get intravenous TPA when they've had a stroke. And so there is now more and more an important agenda of all physicians who do stroke in how we can go about changing behavior to get people to prevent stroke and to get people to call 911 immediately should they witness somebody having a stroke. And Dr. Bernadette Boden-Obala from Columbia University gave an excellent talk about the theory of behavior change, how in and of itself it is a scientific discipline, and that we must use those scientific disciplines in order to motivate behavior to do the right thing.
Now, based on discussions you've had with your colleagues, is there an increasing feeling that doctors can do more to get their patients to change their behavior?
So I think that doctors have a lot of challenges in their practice. We have to see more and more patients. Reimbursements are down, and we don't have as much time as we would like to take with our patients. But there is considerable amount of research that taking those extra minutes to counsel patients on important aspects of behavior, smoking cessation, weight loss, proper diet, regular aerobic exercise, makes a huge impact in prevention. It also is really important that we continue to spread the word not only about what the warning signs of stroke are, but to tell people how important it is to call 911 because we can actually arrest the disability that's caused by stroke if we can get people to the hospital quickly and get them approved acute stroke treatment.
Well, Dr. Morgenstern, thank you very much for taking time to give me some of your highlights.
My pleasure.
For InFocus, I'm Todd Neale, MedPage Today.